My name is Lionel Le Duff, and I'm 64 years old. I'm originally from New Orleans. I first noticed that I had a problem health-wise was back in about 2005. I was walking through the parking lot where I was employed at Hughes Aircraft, and it was a very exhausting walk. Every 2 cars I had to stop. I knew something was wrong, so I went to the doctor and I told them that this was a problem. And at the time, they would take different tests such as EKGs and blood tests and say, nothing's wrong. Well, I knew something was wrong because the exhaustion just wasn't a natural thing. So as I progressed, I got worse. And then around that time period, they also diagnosed me with diabetes as well. I drove from Compton all the way to Linwood, where St. Francis is. And when I got there, the physician that was on duty could not believe that I was still talking, because after they took their test, they saw that the ejection fraction rate was only 13% and could not see how I would still be conscious. Several weeks later, they found out that I had 2 blocked arteries. So they set me up for the bypass, because they actually had to take the heart out of my chest, because I had 2 arteries behind the heart that was clogged up as well. My heart was 3 times bigger than a normal heart. So I was in worse condition than I'd ever imagined after being told that. So I stayed in the hospital a few days, and then I went into rehab and I started coming back, but there was still a problem in the blood flowing back into the heart. When I started coming here, I was a little skeptical because I couldn't imagine how the EECP was going to help me. Well, after I had gone through the first trials of the 35, I started feeling better. And then I went into my second phase, and when they eventually did some tests here, like the echo, and they did some other testing, it showed where my heart started shrinking down to almost a normal size, but not quite. Also in the testing, it was showing where I had some new arteries growing around my heart, which was just fantastic. I didn't even believe that could happen. I did hear it in the nutrition part, where Sarah talks and tells you as you're laying on the table and gives you each one of her sections of nutrition and what could possibly happen going through the testing. Then I started finding out that my ejection fraction rate was going up, and I was so thrilled with that. I just couldn't imagine that all of this was happening to me, and it was becoming more and more successful. So I have truly enjoyed this, and I've been coming since 2008, and now it's 2013. I've had the experience of being in the hospital and not getting the kind of treatment there that I get here. So this is something that I think a lot of folks need to look into, especially African Americans, because we have the propensity to have high blood pressure. We have the propensity to have heart issues, strokes, and it's based on our diet. I know, because I come from New Orleans, where all the rich foods were born. If you're young, it's not so much going to affect you, but as you get up in age, all of that is going to be collected in your body and eventually end up like I did. Not in all cases, but I have to speak specifically in my case, and I know that it was my diet that brought me to the point of where I am, because of the high fatty foods that I was eating and the grease that was involved in the cooking as well. All of that was bad for me, because now I ended up with a heart attack and had a four-way bypass based on my diet. So what I've learned here is very important to really look at what you're putting in your body. One of the things that has stood out to me coming to Global Cardiac Care Center are the individual techs that are assisting when they're setting you up for the wrap and putting the monitors on you. They've taken an extra step to talk to me specifically about the things that are wrong with me: blood pressure, cholesterol, diabetes, and they will discuss each one of those things with me to help me understand it, and then some examples of what I could do to improve it. That has always stood out in my mind, and I'm grateful for it because I'm getting educated that way, as well as Sarah's tapes. But to have people to take that time and go through those different things, I mean, people like Niles, Dean, Josh, Scott, all of these folks have always given their all in terms of helping to understand what your illness is. You don't get that from the doctor. The doctor will ask you, well, where are you hurting? Okay, here are your pills. Oh, you're hurting so bad? We're going to do an operation. Here, it's dealing with the symptoms. And yet, when I say dealing with the symptoms, that's basically what the doctors do, but they deal with the symptoms in the cause, where the doctor doesn't really care about the cause. And when I'm here, they know what the symptoms are, and then they go straight to the cause, and they say, okay, here are some examples of what we can do to improve that. I believe that if my father, a couple of my uncles would have known about this place, they would be alive today. I believe that Global Cardiac Care Center has saved my life, period. I wish I would have known about Global Cardiac Care Center before I went into the four-way bypass, because I believe that I could have not had such an invasive treatment, the operation, the surgery. And I have seen other people around here, like Don, who's on one of your tapes, talked about the stents that he took in and it didn't work, and that they wanted him to have the bypass and he didn't have it, and he's still existing. And I've had the pleasure of meeting him while I was waiting for one of my treatments, and we talked for a minute or so. And I do believe that this place has saved my life and has continued to help me improve. But while I was here, the one thing that impressed me about Global Cardiac Care Center was the compassion. The compassion that each one of the techs have, the nurses, and even the folks that are working on the floor. You're greeted by each and every person, and it makes you feel good, because if you're coming here and you're not feeling well, you don't like to see pruned faces or folks that have an attitude. And we run into that enough at the banks and at the grocery stores. You don't need it at a place like this. And I didn't even experience that kind of stuff. It makes you feel like you're at home. It's a family atmosphere here, which is so good because it makes you want to come. And I think that that kind of environment permeates a wellness. The person can also make themselves well being in this kind of environment. And I can't say enough about this place, how it has helped a number of people. I've sat next to people who've told me how much they've improved. I've shared with them how much I've improved. And we all come to the same consensus, is that the compassion that is shown in this environment is very helpful and very meaningful to people who come here who are under various health strains that is just taking over their lives. You come here, it's almost like coming to Disneyland. I'll just be honest with you. I enjoy it and I really appreciate it. So Sarah, thank you so much.